刚从诊所出来，然后这个是 Dasha， 我们刚刚聊完。本来应该来的时候先录的，这个是 Ecomed SDK， 它的整个这一栋楼都是这家诊所。进去录了好长时间的视频，但是门口我没有录。它位置还是很靠近这个，就是在市中心。从地图上 Google Map 上看的话，是在阿斯塔纳这个几个字的这个周边，对面是阿尔曼，然后我现在还要去找另一个朋友，外面特别冷，我得赶紧换件衣服，晚点回去我把视频再剪出来。等于这次要倒着来，把这段放在最前面因为整个一栋楼都是这家 Ecomed 诊所。这家目前1年3000个周期的话，这个周期数量包括我看里面的设备有3台这个 Timelapse 时差培养箱，然后他们实验室的主任，那名字特别长，我老记不住，刚跟那个 WhatsApp 上给我发过来。据他跟我讲，这个目前应该在哈萨来讲，他们算是 No.1 吧。包括像 LM、Ecolife 呀、Private 啊，很多这些诊所应该周期数量各方面不如他们。然后晚一些胚胎师，就是他们这个胚胎实验室的主任会把他们患者的一些数据会发给我，我也可以看一下，大概就清楚了，好吧。A blood test here, okay. Yes. Storage room for medical products. Okay.
Conference room.
Conference, okay. This director room.
Embryologist laboratory and
Oh.
the operation.
Okay, operation room on the.
Yes.
Okay.
And
How about that part?
Вы знаете пароль? Вы знаете пароль? It's like ultrasound and reproductologist.
Ultrasound, okay. Use the fingerprint. Hello， 大家好，我是 Frank。调一下。OK， 现在我们于哈萨克斯坦首都阿斯塔纳市中心的一家生殖诊所生殖中心。这家生殖中心已经有30年的历史了。他们新诊所在阿斯塔纳开了也有15年，从2015年至今。目前接待患者数量非常多。然后我们刚刚也是有幸和院长 Almas 先生，也是 Professor Almas 跟他沟通了很长时间。然后下一步准备他这边让我们整体的做一个拍摄随访，包括介绍。这家诊所呢是大家自己也可以去找Ecomed，它对外对内的整体价格都是一致的，而且它的目前在整个哈萨克斯坦的周期数量，包括交付数量，包括价格也是最多和最高的。阿马先生，在这边我们刚刚从他的办公室里面出来，还需要is our need to with Almas is busy for work?
Yes.
Okay.
You go to ultrasound.
OK， 他去做 B 超去了，因为他比较忙。我们上午等了他好长时间，2个小时他才出来。OK， 这边是我的2个合作方然后Madina 和他的父亲Talu OK，we can look around here from this room.
First one, it's analysis, the laboratory where you make a blood test and other thing.
OK， 这是抽血的地方Only for the blood test.
Only for the blood test.
OK， 我们可以看一下。啊，这个镜头我要转一下。就是一个抽血的一个，看得不太清楚。对，这样看得清楚一些。OK，
So here you can see ultrasound rooms. We have
B 超室。
6 cabinets.
6 room。
6 room ultrasound room.
Ultrasound room 有6个 B 超室。
Yes, it's our
这是能看到，这是
main doctor.
Almas， 就是刚刚跟我们聊了好长时间的，也是院长他们的创始人。OK，next step.
Next step is doctor's room.
Doctor's room.
Here we have 2 doctors, Mr. Danat and Mrs. Nazgul.
OK.
It's Alma's assistant's room.
Sorry. 这是另外一位医生的房间。
It's another reproductive doctor, a C.
Is the doctor all the doctor is reproductive doctors?
Only reproductive doctors.
Only reproductive doctors. OK， 这些都是生殖医生。他们应该是有7位生殖医生。然后刚才的 Almas 他是这边的总医生。
It's also our doctor, Islam.
Islam.
Reproductive.
OK. And how many embryo doctors here? You know?
Reproductive.
It's downstairs.
Yes, 3 women.
3 women.
And
For the embryo, I mean for the embryos, not for the reproductive. Yes.
embryos, I'm not sure.
Okay.
We will ask from embryo.
Okay. Maybe we can ask Almas later. 还不确定他们有几位胚胎师，但是整个胚胎实验室在楼下，楼上的大概总面积我预估得有3000平左右或者更大吧啊。这个就是我们刚刚在，这是总医生 Almas 的办公室，刚才我们就是在这里面沟通了好长时间，可以看一下啊。Almas 他的全是已出生孩子的照片，OK. This way.
It's our reception room.
这是大厅。你看有好多的患者，从早上我们9点过来到现在，一直是人满为患的一个节奏。转一下镜头。OK。哎，大家都在看我进行拍摄。Next， 这是阿依达啊，我们的 manager，OK。OK。
It's a lawyer.
Lawyer， 这是律师的办公室。这边是什么办公室？What's this room?
Administration.
Administration. OK.
The head of administration. Here we have a pharmacy.
Pharmacy. OK.
Pharmacy where we can buy injection.
OK.
Hormones.
是药
Here
房。
is a treatment room where it's taking a blood test.
Treatment room. OK. 这个是近2年我见的生殖中心里面应该是规模最大、最规矩，并且装修最现代化的，而且他们用的是时差培养项。刚刚这个 Almas 在电脑里面给我看了好多他们的数据结果，因为我问他目前所有这个患者的情况，然后根据不同的年龄，他们的整体数据情况怎么样？我看了一下，整体结果还是很不错的。OK， Oh, it's a meeting room. 是个 So it's a meeting room?
Yes, it's meeting room.
Okay.
Where we will wait embryo.
Okay.
And it's pregnancy.
Pregnancy
monitoring.
mother department. Okay, 这是 pregnancy mothering department. Next.
And it's a cabinet where it's a gynecologist works.
Oh. Procedure room.
Yes.
Procedure room.
And the last offices is where urologist is sitting.
Okay.
It's very popular doctor.
非常知名的一个医生
Azamat.
Azamat.
Yes, he is urologist urologist. He's very popular in social media. Have a lot of
Oh, okay. Ologist.
patients.
Patients. Okay.
So it's all. I think now we will wait.
Okay. That's all. Where this way?
There is only bedroom and
病房。
yes. We have here the how to say
可以看一下他们的整体的平层示意图。一共有43个房间，加上楼下的、地下的是胚胎实验室，胚胎实验室是不允许随便入内的。然后这边是他们员工通道，我们是过不去的，需要用指纹，包括2个卫生间，这个需要用指纹才可以进。但是刚才我看他们很多员工都是去这里面，具体是做什么的？也是 ultrasound room。OK。
Now we'll wait in conference room and embryolog will come.
Can we come in the downstairs?
Yes, he come into conference room. We should wait him.
Okay.
And then he will show you our laboratory, how embryos is creating, etc.
All right, of course, great. 好，我们下一步在 conference room 等一下他们的员工。I know meeting room. Wait here?
Yes, we are here.
Okay. 那我们先暂停一下，一会儿去胚胎实验室。Hi, so you can introduce yourself?
My name is Damir.
Damir.
And I'm head of IVF lab
Okay.
in Ecomed clinic. So, what do you want to do?
We can to see the embryos room.
Yeah,
Yes,
sure.
And our machines.
Yeah.
Okay,
Now we go into our
Okay.
embryology lab, and I show you what we have
Okay,
and
thank
what
you.
we can do.
Appreciate.
What we do. So, but our director has introduced the clinic.
Yes.
About the volume of.
You see Mr. Almas?
Yeah.
Yes, we just talking about a lot of things in his office.
Okay.
Okay.
Let's go.
好，我们现在去 embryos lab。
We are largest. Yeah, one of the largest clinic in Kazakhstan.
Okay.
About the volume of work.
Okay, thank you.
Our main direction is not only the volume and doing the conventional IVF, but also we specialize on the new technology and try to introduce in our lab and in our clinic
Okay.
the most novel technologies. So you see that we have a little bit complicated way.
Okay, complicated way.
That's because the third side of the clinic was here, and in 2015 we buy a new building, connect.
Okay.
These two sides between that. So, one minute, please. I give you.
Okay, I need 我要穿一下鞋套。I try to close. So, 好，那我们先换一下衣服，稍后再继续。好了，我们换好衣服了，现在准备进去参观一下。这是他的办公室。So you see your office?
yeah, it's a little office just for the some usual work and little storage.
哦，这有很多的试剂。
Few days. Just little supplies for a few days and
Supply maybe 1 week? Oh, believe it.
in down part of the of this storage, it's yeah, some around 1 week.
1 week,
But
okay.
in upper side, it's a little bit.
The
That's
pharmacy.
it's not a pharmacy. That's things that we have, not a lot, but just show you, like buffers for the pH meter. That's
Okay. Outer
It's
ring
only
board.
one box, and it's not stored in the
Okay.
main storage. It's simply stored here. So the things that
Okay, we can
yeah.
go ahead.
So we have the clean room technologies. We have a clean room technologies in our lab. So that's operation room for the all-site aspiration.
Sorry. Operation room, okay.
Yeah. On the left side, that is we make this andrology lab. That's male semen preparation is happening here.
Okay.
It's all things making here.
Okay, so fetch the egg here.
Oh.
So the fetch the egg here or ICSI here? ICSI or
No. That's only for semen preparation. That's,
okay.
No. That's in the room, not for the EC.
For the sperm. Sperm. Yes.
Yeah.
Yes.
For the sperm. Just
离心机啊，然后这边都是液氮罐，好多的液氮。Okay.
So
from the operation room, there is a window, and that way is fetch the egg and do the ICSI. Yes.
yeah.
Okay.
This is the cryo storage.
Yeah, I know.
So that's we have a lot of liquid transfusion tanks.
现在准备去手术室做。
So because today is not a lot of work.
Okay. Hello.
We have the laboratory now have a little rest.
3台时差培养箱。
Conventional, for the scheduled cleaner.
OK.
对，
今天他们说工作不是特别多啊。然后3台时差培养箱，包括。So how to use this machine? How to use this machine?
Oh, that's a stereo microscope and
Yes.
laminar box. That's only for preservation, for the freezing and throwing.
For freezing and throwing. OK.
Yeah. That's the patients for today for the nerve transfer.
Embryo transfer.
So that's conventional incubators just for the few patients. When we have a little bit more cells, then can put it in an embryoscope in one dish.
Okay.
So we have some internal policy for the one patient. We use only one dish for the embryoscope. If the doctors not saying other decision. So that's pretty machine of the embryoscope, and 90 somewhere 2,000 of cycles is going through the embryoscopes.
Yes.
So not all the patients is going into embryoscope because this is not free of charge for them. We selling the space in embryoscope for the patients. So
Right.
and, that's because they were very pricey, and so we need to sell these opportunities for the patient also.
So how many patients we can handle in this embryo labs under the operation room?
So today we have some around 5, I think, no 4. Today we have a 4 OPU. That's all sides.
Okay. So today have 4
Operations.
operation.
Oh,
4 patients operation. Today.
today, it was just 4, but usually that's in average for the year we have a 3,000 OPU.
Operation.
Yeah,
一年有3000个周期，3,000
yeah.
operations 1 year per year.
Per year.
Oh, it's plenty.
We are pretty
Plenty numbers.
large. Yeah.
Yes. Okay.
So about the technologies, we have 3 microscopes for the XC. But we introduce the piezo XC also. We transfer this technology from the Japan.
From Japan. Okay. Olympus. I know this machine. Yes.
Yeah, and also we have the newest for this methods is a piezo XC. That's more
Pixel expert. Yes.
yeah, that's more safer for the all sides.
Yes.
And so we just introduce this technique, and so this workstation with the microscopes is used for the all sides searching and for the XC procedure.
Okay.
Also for the biopsy of trophobacter,
Right.
because we do a lot of PGT.
PGD.
So good. And
So
also-
our embryos then finish the embryos 5 days and cut the embryos 5 to 10 and send this to another examinations.
we work with the outside lab.
Outside lab.
Yeah,
Okay.
we.
So usually the patient will waiting for how many days for the report of the PGTA?
Just the company can do the results somewhere around 2 weeks.
2 weeks.
Yeah,
Okay.
but we are saying for our patients that they need to wait 1 month,
1 month.
because sometimes about in the reason of logistics and sometimes delays,
Okay.
that sometimes it's happening with the outside lab. We just give for the patient 1 month,
Okay.
because that's give the secure time for give the results in time for the patient.
Okay.
So, and what I can say also, the operation room. If you want to see And final next step, I show another technologies. That's like a conventional outside pickup.
OK，
Room. That's ultrasound. Also, we use some operations here in a gynecology manipulation. It's not operation. That's a hysteroscope. So if doctors see some troubles in uterus, they can fix them by hysteroscope. That's simple procedure, not very complicated.
OK，
So complicated operations we don't do here. We have also one andrology lab. I also show you
OK，
in a new building. They have an andrology lab. Andrology, not lab. They have an andrology operation room. Yeah, for the microdose. So, and now we also transfer the technology from the Japan is ROSI technology. That's when we have a very bad male factor, when the male haven't any sperm. And the sperm is not extracted in a testis. So we make the surgery for the taking the sperm from the testicular.
Yes.
But if the patient haven't any sperm, we have technology for use
the operation to use the very
Yeah.
long, how to say that?
microteser.
Yes,
Yeah,
microteser.
we have a microteser, but additionally in an embryology lab, if the patient haven't any sperm in a microteser, we can use the round spermatid. That's the cells that would be that will be the sperm maybe in the next.
Alright.
But
Is another room?
in the lab, that's all.
Okay.
But for the operation andrology, for operation room for the andrology, I showed you we need to go in another
OK，
place. So
无精症患者取经还要在另一个房间啊。OK，so this lab is finished.
yep.
OK, just stop here and then maybe continue.
Sometimes some media is give you a little bit better results than other. And when you use simultaneously two media in one for the one patient, for all patients actually, you have the opportunity to balance on a to cultivate on a better media that you have. And if something could go wrong with the media, you see that you because you have for the control the second media. So that's our
它这个里面都是它的耗材试剂，就是胚胎实验室所用到的，说是2个品牌嘛，然后 Vitrolife 的用的比较多。我拍个照。
one other brand that we use. That's
Another brand,
Cryotech, yeah.
Vitri.
That's
Jumbo Pack 30.
Kuwayama company.
Cryotech.
Cryotech. That's
Cryotech.
technology Cryotech. But
Oh, technology.
I think that's
Ready to be-
ReproLife. That's from Japan.
From Japan, Pro
Yeah.
Life. OK， 这是另一个牌子的。
That's the method for the freezing all sides.
Freezing all sides. OK.
Yeah.
So protect the embryo.
Yeah, that is also for the
So
embryo.
it's a protector.
Yeah, that's cryoprotector. Yeah.
Okay.
That's for the freezing. This method introduced the Kuwayama. He's he from Japan.
Oh,
And firstly, he worked in an academy, then worked for the Kitazato. And then they go by different ways. And Kobayama opened their own company. That was in 2007, I think, maybe. But this media is absolutely new product. They introduced in Japan in 2022, I think, and for the world that was available in 2023. That's absolutely new product with a new chemistry, and we have now we see the much higher survival rate on them. So that's the best media is for the freezing that we saw.
So I'm wondering we can accept another countries' IVF centers embryos to our clinic. Use that one. Maybe use this one for transfer.
For transport. Yeah, yeah, absolutely. We have a lot of, but that's
就是我
that's for
们
the
这个 Ecomed 是可以接受胚胎转移的，胚胎转运从其他的诊所。比如像本地的 LM 他们是不接受外来胚胎的，但是Ecomed 这边是完全可以接受的。
usually use
他在给展示这个手提钢罐
this one for the
OK.
transportation.
So
It's
if
only
you
for-
take this to by plane, you need to buy a ticket for the.
Yeah,
That's
that's
actually-
actually special design. That's dry shipper.
From France.
So.
OK.
So that's dry shipper. It's not required liquid nitrogen for the transportation, and that's allowed for the air transport. So you can fly with them.
Yes.
But that's very complicated thing. Actually, we use also outside the company. We can transfer embryos around the world.
All right.
And usually we have a situation when our patients is transport the embryos, all sides, sperm from other country to
Yes.
us.
Sperm, eggs, embryos.
Yeah, all of the things is usually going to us.
Okay.
From us is not the usual situation when we send some embryos outside, but that's also not a problem. It's
So
usual.
let's finish our recording.
Here, yeah.
It's all right.
Yeah.
好的，那我们就介绍到这里。谢谢 ，Thank you。
Thank you.
You can wait here。我们接下来最后一个参观的是，对于无精症或者取精困难患者的手术室，取精手术室。 我切换个镜头。
So that's operation and surgery. Yeah, surgery room for the microteser. That's especially for male factor.
OK.
When the
He's hurt. Is male feel so pain? Or use the.
we have anesthesia.
Okay.
Anesthesia, and they didn't feel any pain.
OK.
So that's. I think for the male, it's the sewing situation is painful, but the patient is absolutely with anesthesia and some painkillers. That's question for the.
And how about this machine?
Oh, that's microscope for
Microscope.
the surgery.
Surgery. OK.
And that is one step behind the high-end model that says have. The best model is 900. But this is 700, and in Kazakhstan that's only few of them.
All right.
Because that's very advanced microscope.
All right.
So neurosurgery use that. We use this equipment just for the microtaser.
How many times we use this per month or per year?
2 times per day.
2 times per day. Okay.
2 to 4 times per
4
day.
times per day.
Yeah, for the year, actually, I didn't calculate,
So we can.
create a statistic about the application. This.
So that means we have lots of patients. They don't can fetch the sperm by themselves. So need to use the microscope.
Our
我们俩这英语都不怎么样，所以
s-
跟这儿猜。
our surgery specialist, andrologist, yeah, surgeon, I think, yeah. They use this microscope in a microtaser because when you just take the tissue by the naked eye, it's you just take tissue and that's all. When you use a microscope, they what do? They see that microtubules is more probability to have this sperm. So and they choose especially the best microtubules in a testis. That give 2 opportunities for us because we with this method we the chance to find that the sperm is higher.
Yeah.
That's one opportunity.
So choose
the second,
the best one, the stronger one, maybe.
yeah, something like that. But second opportunity, that's for the patient because they not take a lot of tissue.
Yes.
They take only small amount of tissue that can give the good result. So
Yes.
and that give for the patient the shorter time for recovery and much less side effects from the operation.
Okay.
So, and that because of that we use this microscope. That's also very expensive machine.
Yes. I see.
And,
看着就不便宜。
some yeah, maybe some clinics and hospitals is thinking that we little crazy
Yes.
plans because we use very expensive equipment for the for the operation that not life saving.
All right.
This is just operation for the making the babies, you know. But we for the efficiency and because of that we use this machine. Also, that's actually for the anesthesiologist. That's this machine for the anesthesia. Actually, I know a specialist in this field and can say about what machine would do and what it is. I also have an inverted microscope. That's simple inverted microscope.
Yes,
because
simple one.
that when an andrologist is making the microtaser, he needs the decision continue or stop that. And for them
choose the sperm.
yeah, only for him need real-time feedback about the finding the sperms or in a microtaser or not. And our embryologist is sitting here during the operation and just doing the microscoping
Right.
to give information for the andrologist. So,
Okay. So we finished?
yeah.
Okay.
Yeah. Today, now we finish.
Okay. Thank you. Okay. Stop here. 我们到阿斯塔纳的 mosque， 进来之前先要穿鞋，把衣服放在这儿。OK。然后他们进来需要把头都包住，不能露出头发，因为是穆斯林。进来都是女人都要换上这边的衣服，头发必须要包住，不能露出来。今天外面雾特别大。Yes。这地方特别漂亮。
They have boxes, and every person take money.
OK。
Give money.
说这个地方，I'm just recording 。刚才尔金给我解释，他说这个地方24小时都是开着的，所有人都可以来这里，可以休息，可以睡觉。如果你无家可归，也可以来到这里，然后有免费的食物和水。刚才说的那个白色的箱子可以往里面去捐款。